The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the NNN webinar series on cancer risk reduction in Indian Country. This webinar is titled American Indian Commercial Tobacco Program Updates. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service Health and Disease Prevention, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian Country, and the Indian Health Service Clinical Support Center. Your presenter today is Hilary Baca, Client Relationship Manager with National Jewish Health. We are pleased to offer continuing education credits for participants in this webinar. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses. To obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey, which will be emailed out to all the attendees tomorrow. By the end of this webinar, participants will be able to identify the key elements of the American Indian Commercial Tobacco Program as a means to meet the needs of the population and improve engagement of evidence-based cessation strategies, collaborate with state and tribal partners of the American Indian Commercial Tobacco Program to lessen the impact of commercial tobacco on the American Indian population, and appropriately refer patients to the tobacco dependents to state and tribal smoking cessation programs provided by the American Indian Commercial Tobacco Program. And now at this time, I am going to throw it over to our presenter, Hilary Baca.
Thank you, Mike. I appreciate it. And I really appreciate the opportunity getting to speak to everyone today about the American Indian Commercial Tobacco Program that we've created here at National Jewish, or as you'll see, several references to the AICTP. So I thought it would be really helpful first to go through a little bit about National Jewish. And I apologize, it's a little slow here. So we are a nonprofit, non-sectarian hospital here in Denver, Colorado, and we opened our doors in 1899 really as a tuberculosis hospital. At that time, tuberculosis was the #2 cause of morbidity and mortality in the US. So fast forward to now, we are still working within to serve those facing the #1 and #2 causes of morbidity and mortality, tobacco use, and obesity. So we are primarily a respiratory hospital at National Jewish these days, and our program here at our Health Initiatives Department houses what we call our QuitLogics program. We run Quitline for 16 states actually, and over 150 employers and health plans. And we've been operating the Quitline services since 2002. The state of Colorado was the first state to come on board, and we've been so fortunate to bring on usually about 1 to 2 additional states a year, and now we're up to 16. So I'll get into more detail about which of those states we're working with on this particular project. And Mike, I apologize, but the slides don't look like they're, there we go. I apologize. Okay, so the next slide, I just wanted to give everyone a picture of our call center. So it's often a mystery what our operation looks like. We are about 2 miles down the road from our actual hospital in Denver. We have over 120 staff on our call center floor. That includes client service representatives. Their primary function here at the Quitline is to do intakes. So they really just do the preliminary questions, and then they forward the call over to a coach to get into the coaching and nicotine replacement therapy ordering. And then we have coaches. So we're at about 20% CSRs and 80% coaches out on the floor. So the majority of the folks that are going to be answering the phone on our end are going to be coaches. From there, we have about 5 or 6 team leads, and then we have supervisors as well. So we have a pretty large team out on the floor that answers these calls every day. We do a pretty intensive training for all of our coaches, regardless of which program they are in. We have a specialty program for pregnancy as well. But it's about a 4 to 6 week training program for our coaches, which includes some pretty intense classroom training. We do a lot of training on motivational interviewing. They actually have to test in that training. They do some shadowing on the floor of other coaches. And then they have the opportunity to earn their TTS certification, actually. We have an in-house training department and we've been certified to offer the TTS certification. So all of our coaches have that opportunity, which is really great. And then in addition to that, we offer monthly continuing education training, which covers a lot of different topics that we really changed it up a lot. But some of the recent ones that we've done, mental health training. About 50 to 70% of our callers into the Quitline self-identify as having a mental health issue of some sort. Montana and Minnesota have both brought in American Indian trainers for us, for our staff, which has been wonderful. We've had Dr. Scout come in and do some LGBT training. We, of course, do training on emerging tobacco products, including vaping devices, e-cigarettes. But we offer a lot of additional information for our coaching staff and our CSRs so that they can be better equipped to work with those calls. And now really what we're going to get into today is the American Indian Commercial Tobacco Program. So we launched this program in August of 2015, and it's really started off as a pilot project for us. We had 8 states participate in this pilot project, and over time we'll be adding more states to this program. We've had more express interest in joining up with it. So the background behind this program and the reason we got it going is we observed over the years that American Indian callers specifically had much lower rates of engagement and utilization of Quitline services, and also lower quit rates. But there was definitely a very strong interest in quitting. So, we had a few of our states especially express interest in doing something for this population, and they were instrumental in helping us get this going. To elaborate on that, especially in Montana and Michigan, those are 2 of our state partners that I feel were instrumental in getting us information from out in their states. So they performed talking circles with those in their community and found out what people felt about the Quitline, what they thought would be a benefit to doing this program and what it should look like. And one of the things that came up pretty often was that we needed to have American Indian coaches. So we found that out among many other things, and that really helped us shape this program. So some other stats that we found when we were going through this process was that almost 20% of American Indian callers drop out at intake. 60% dropped out after 1 coaching call on average. About 20% completed 3 or more coaching calls, and we consider that the minimum number that's recommended for an effective cessation intervention. And then the American Indian callers were completing on average 1.7 coaching calls versus 3.2 for our general population. So almost half the rate of the general population. So something was going on there, and we knew that we needed to change some things around in order to to really have an effect on cessation for the American Indian population. So our main goals for the American Indian commercial tobacco program were to create a dedicated coaching program with a culturally sensitive coaching protocol to better meet the needs of this population. Improve the engagement of American Indians in tobacco cessation services, help our state partners increase reach into these populations, and of course, lessen the impact of commercial tobacco on this population. And really, our clinical director, Dr. Amy Lukowski, was really the one that got this program going, and she really felt that while cessation is considered a very positive outcome, with this population, she really wanted to set the goal as a reduction of tobacco use associated with harm reduction for the tobacco user. So kind of different than how we view the general population. So our participating states in the pilot program were the states of Alabama, Arkansas, Colorado, Michigan, Montana, Nevada, Pennsylvania, and Wyoming. So this is, again, a small subset of the total number of states that we work with. They were very interested in participating in this pilot project. You know, we have folks within some of these states that it's specifically their job to reach out to the American Indian community. And like, I'll call out Janet from the state of Montana. She's been so helpful in getting this going and keeping this top of mind for us. So our original program design offered a phone or web phone protocol, and I'll explain that a little further. So the phone protocol is just as it sounds. The phone protocol is just, we're talking to that person, we're doing phone counseling. They don't use any other means of program participation. And a web phone participant, all that is that somebody that's jointly using our phone coaching along with our website to gain additional resources. We offer up to 10 coaching calls with these dedicated American Indian coaches, and I'll kind of introduce them later on in these slides. But we found that we really needed to offer potentially a longer length of call and follow these participants for a longer amount of time. So our typical program it's a 5 coaching call program. So we typically do an intake and then 5 coaching calls after that. And so for some of our protocols for special populations, such as this protocol and our pregnancy protocol, we offer up to 10 calls because we feel we'd like to follow these folks a little bit longer. The reset attempts, I'll explain that. Resets are calls they're attempts that we make to reach somebody, essentially. So for the general population, we're trying 3 different times to reach someone, and if we are unsuccessful at that, then we discontinue contact. So for this population, we felt that we needed to increase the number of attempts that we made to reach these folks. And then for referrals, if we receive a fax referral from a physician, that remains the same. That's 3 contacts in a row, and if we're unsuccessful, then we stop contact. The nicotine replacement therapy benefit really varies by state. We created this program with the intention to offer a total of 8 weeks of nicotine replacement therapy, patches, gum or lozenge, combination therapy as a potential offering. We also are lucky enough to have 3 states that I have listed here, Montana, Wyoming, and Colorado, that offer Chantix for their Quitline users as an additional option. So what tends to happen, and the reason I put in that this varies by state is that some states can face budget cuts. It's been happening more often than normal lately, and because of all that, sometimes they have to decrease the amount of NRT that they offer to callers, or put different eligibility requirements around that. So for the most part, most of these states that we're working with are offering somewhere in the neighborhood of 4 to 8 weeks of nicotine replacement therapy, but it really does vary by each individual state. So I wanted to go over a little bit about how enrollment in this program works. We have a dedicated toll-free number, which is 855-372-0037, and this number connects directly to our AI coaches. There are 3 of them, and this way, any caller that's coming in can get right through to them. They don't go through an additional set of staff before. They can just skip right over. The one thing that can be a little bit of a challenge that way is because there are only 3 of them. People calling into this specific number, depending on high call volumes and things like that, they may get voicemail, and they should get a return call within about 24 to 48 hours from one of those coaches. People can certainly also enroll through 1-800-QUIT-NOW, which is that nationally televised number. So that number rings through to each individual state. And for the 16 states that we serve, 1-800-QUIT-NOW will ring to National Jewish based on the area code of the caller. So if for some reason someone that's interested in enrolling in the AICTP calls 1-800-QUIT-NOW, one of the first several intake questions that we ask the callers are if they identify as American Indian or Alaska Native. And if we determine that there's a yes to that question, then that intake specialist will explain the AICTP and ask if they would like to enroll in that program. And if they opt into that, then they are transferred over to one of our AI coaches. So you can get to the program either way. It's a little bit faster if you just dial their direct number. Our 3 dedicated coaches are Kim, Sarina, and Marie. Marie is actually brand new as of a couple weeks ago. She was a CSR with us, and she has moved into a coaching role, which is wonderful. We're really excited to have her. I don't have a slide on her, unfortunately, yet with all of her information, but I will introduce Kim and Sarina to you. These coaches only take inbound calls for the AICTP, so they're kind of in their own little pod, so to speak. They are not taking inbound calls for our general Quitline population because we feel that we need to keep the lines open as much as possible for the AI callers. Their schedules, after doing a lot of evaluation on their schedules, we've moved it around a lot since we started this pilot back in August of 2015. But we have moved them to a Monday through Friday schedule, and between the 3 of them, they cover hours between about 6:30 a.m. and 7 p.m. or so, Monday through Friday. And they do overlap a lot during those time frames. Those were really the days of the week that we were getting the most inbound call volume for this particular program for these coaches. So we'll continue to make adjustments as we go, but that is how the schedule sits right now. And we will also continue to recruit additional AI coaches. That's something that we have really struggled with. It's taken us a long time to find some really great people, and we're really lucky to have all 3 of them. But we continue to recruit constantly here in Colorado. So if you know of anybody, please forward them our direction. We also have a website dedicated to this program. So the URL is on the page here. It's americanindian.quitlogics.org. And really, that website is an informational website. It gives additional resources, but it also allows the participant to enroll online. So if the participant doesn't have time maybe to go through the full intake process on the phone, or they couldn't reach a coach right away, they could actually start their intake. They do an abbreviated intake on this website. They indicate which state they're from, and then that information transfers over to our database. So when we actually do get them on the phone, approximately a third or so of that intake is already completed. So the coaches only have to ask the number of questions that weren't already filled out. And then program eligibility is actually, as I mentioned a couple minutes ago, it's assessed right before the intake or in the beginning of the intake. So if a caller identifies as being American Indian or Alaska Native, we then explain the AICTP program in depth, and we ask the caller if they would like to opt into that special program. We find that the vast majority identifying in this population, they do decide to opt into the AICTP, but we also have a number of folks that opt out. They say they don't want to participate in this program, and we were really interested in that data early early on, several months ago, and what we found when we dug into it a little bit deeper was that the folks that decline the AICTP program, about 80% of the time they identify with more than one race. So maybe their AI identification isn't, maybe they don't consider that to be primary. It's just they have more than one race that they identify with. So that's good news. The vast majority of the folks do actually decide to participate, though, which is great. For the intake process, the intake is actually divided into required and optional questions. That was one of the things that we got a lot of feedback on from the different communities, where our intake was too long. It was offensive. We throw a lot of questions at people in the beginning before we get to know them, and that's true. By design, the states have this set of intake questions called the MDS, or the minimal data set, and they contain a lot of demographic questions. We have a lot of tobacco usage questions in there, and the way the general intake is designed is that we have to get through all those questions before we get into any coaching. And so what we did for this program was that we kind of divided that into chunks. So we have the first set that are really the required questions, and they're really important for our coaches to know. We ask for their tobacco status, how much tobacco are they using, what type of tobacco are they using, some medical questions, things like that, the ones that we consider that are really important for our coaches to know before they get into coaching. And then they give the participant the option to complete the rest of the demographic questions if they would like to. And if they don't want to, they certainly don't have to continue answering the rest of those questions, and they can be filled in later, or just completely skipped, actually. So we think that's working really well, and interestingly enough, most folks actually opt into completing the entire intake, which we didn't foresee happening. So, and again, an abbreviated portion of this intake can be completed online ahead of the call with the Quitline coach. So the next couple slides just really show really high level what some of our materials look like. So to every caller that comes through our program, they get a set of really two or three pieces of material from us. So one is our Quit booklet. It's called My Quit Journey. And they also get a document that contains a welcome letter and 3 pieces of static content. So every person gets in their packet information and infographics about secondhand smoke, vaping, and stress. And then the other 2 pieces in the packet are personalized based on how they answer those demographic questions. So, of course, we have information on commercial tobacco, behavioral health, ENDS or vaping products, COPD, high blood pressure, heart disease, diabetes, LGBT. So there's a lot of different options that could make up this packet, and we really wanted it to be personalized to the participant. And this is an example on this page of the stress infographic that comes in every packet. But it gives you an idea of kind of the different priority groups and how we put those together. So of course, someone could answer, someone could identify with a lot of different demographic groups, and so this is kind of how we prioritize it. And now I'd like to introduce 2 of our coaches. As I mentioned, I unfortunately don't have a lot of information. I don't have the write-up or Marie's bio, so I will introduce you to, this is Kim. And Kim has been with us since the beginning of this program back in August 2015. And this is just, I'm not going to read off all of this, but this gives you an idea of Kim's background and her bio. She's got a lot of really great experience working in similar types of programs. She's a really great coach. We appreciate having her here. And then Sarina. Sarina's also been with us since the very beginning in August 2015. So this will give you an idea of her tribal affiliation and her background as well. Okay. And now I really want to spend a few minutes going through some of the statistics that we've pulled on the AICTP. So with it starting out as a pilot program, we had some base level data. As I mentioned in some of the earlier slides, in terms of participation rates and on average how many coaching calls people do in just our general program. And so I'd like to share with you kind of where we're at this point. So almost 2 years later, this is August 2015 through almost the end of June 2017. So in that time period, we have enrolled about 1,700 people into the AICTP. That's across all the states that we're working with on this project, the 8 states that I mentioned in the earlier slide. So that's really great. I shared some of this data, I think, back last fall, and the number has significantly jumped since I shared that data. So we definitely are seeing on this end that a lot more people are utilizing this service, which is great. And so that's warranted adding additional coaches. And as I said, we're looking for even more. So among this population, one of the things that's interesting is that we only see 42% NRT utilization. So only 42% of the folks that enroll in this program are deciding that they would like to get nicotine replacement therapy through the Quitline. So we don't know why yet. We don't know the reason for that. What we see sometimes in the general population is that they have access to it elsewhere, or we also see that folks in some cases are just not comfortable using it. So when we ran this number, I believe back in the fall, I think it was a higher number. I think it was closer to 60 or 70%. So now that we've got a lot more enrollees in this program, it's interesting to see that less than half are utilizing the free NRT with the Quitline. On average, we're seeing about a 17-minute coaching call, which is really in line with our general population. So we usually average between a 15 and 20-minute coaching call for our general population. It really just depends on, some people will get into 40 minutes or an hour, and some folks will be done in 5 or 10 minutes. Participants really lead a lot of that conversation. That's the whole idea behind motivational interviewing. So it can really widely vary, but that's our average. And then in terms of quit rates, it's something we've been looking at. We have several of the states that are participating in this pilot do their own outcome surveys. So we have data on some of the states that we do outcome surveys for, and it's a very small number. It hasn't approached that statistically significant number, so I'm hesitant to share a specific number, but I can tell you the number that I just looked at, we are getting really close to our average quit rate of 30%. So if that number ends up holding true, again, that's a vast improvement from what we have seen with this population prior to the creation of the AICTP. So these are really super promising numbers, and we're going to continue to monitor this. And I'm hoping when we're able to share this data with everyone in maybe another 6 months or so, we'll have a statistically significant number that we can share a specific number with you all. So this one's really exciting for us. This was one of the things we were most concerned about, is that the AI population that we were serving at the Quitline prior to the creation of the AICTP were only doing on average 1.7 coaching calls. So it was less than half of our general population. And what you can see here, given this last set of data that we pulled, is that it has caught up to the general population. So it's as good, if not better, than what we're seeing with the general population right now. So an average of 3.25 calls. So that is phenomenal. And I think it's a really great testament to how great our coaches are doing at keeping their participants engaged in this program. So we are really excited about this number. And I'm not going to really spend a ton of time on this. I'm not going to read this, but I think it's important to share these success stories with people out in the community talking about this program. Our coaches are really good about giving us these every once in a while. They encounter a participant that's gone through our program, they've completed the program, and they have a really great story to share. And this is one of the stories that I believe Kim gave us on one of her participants. So this just illustrates how this program has been successful for this person, and we continue to get these great stories every day from our coaches. So now I'm going to talk a little bit about how to refer people to the AICTP. So obviously the the first way to enroll in the AICTP is to go ahead and call the 855 number that we have, or 1-800-QUIT-NOW, as I had mentioned. So that's more of a passive referral. People can certainly, or providers out, or community partners can certainly provide the toll-free number to people that they're working with and just have them give us a call. But they can also do more of a proactive referral to our program. So fax referral is one way to do that. I believe the state of Montana created their own fax referral form specifically for this program, and she's distributed among the her community partners so that they can use this, and it's very clear when we receive these fax referrals that they are to go into the AICTP program. Because we get thousands of fax referrals from providers all over the country every month, and so it's great if somehow you can create your own fax form or indicate on the top of that fax referral form that you're specifically referring to this program. Provider web referral can also be done. So you don't actually, it's misleading. You don't have to be a provider to fill this out, but on the different states' websites, there is a healthcare provider section, and there is a provider web referral form available there. So anyone in the community can refer someone. Again, you don't have to be a provider, and you can fill in your information and the information of the patient and electronically submit that to us as well. So that's a really great way to get someone enrolled in the program. And you know, if you fill that one out, that's going to go into our general referrals. And so again, we will just find out this when we get them on the phone that they are specifically interested in the AICTP. So it's not a problem, it's just maybe one extra step. Online enrollment, as I mentioned earlier, on the AmericanIndian.quitlogics.org. You can go onto that website, and the actual participant can go on there, fill in some information about themselves, answer a few of those intake questions. They can indicate that they want to participate in the web phone program. So as long as they do that, that referral will load into our system, and we will call them within a couple of days to finish their enrollment process. One thing that we've been hearing a lot is, you know, some of the great things that are going on in the communities and the states that we work with is that sometimes there's a lack of access to the website or to phones in general, and so a lot of our community partners are getting out there, and they're assisting with the enrollment process. So providing a phone for that first intake call for the participant to use their phone, or providing a computer for them to fill out the first part of the intake form online. It's really helpful, you know, while they have that interest, while they're interested in enrolling in the program, you know, trying to get them to do it while they're sitting there is just wonderful, and we love that people are doing that. So next, I really wanted to get into a couple of slides about just a lot of common questions that we get about how the Quitline works, and maybe common misconceptions. I just think this is really important information for everyone referring to our service to have. So first, hold times. This is something that we hear a lot, especially, you know, since we only have 3 coaches on the AICTP. Based on timing, let's say all 3 of them happen to be on a phone call, you know, what are the hold times? What's the maximum amount of time somebody can wait on hold? It's actually 7 minutes. So somebody making an inbound call to our service, the maximum they can be on hold is 7 minutes, and then the call is forced to voicemail. And then every about 1 minute, 20 seconds during that hold, they can opt into leaving a voicemail for us. So, but at 7 minutes, again, it forces them over to voicemail. It's a little bit different story if let's say we are transferring the caller from a CSR over to a coach. If for some reason they call into 1-800-QUIT-NOW to begin with, and they're being transferred, the hold time pattern is a little bit different there, but this is just if they're calling into our number. In terms of languages served by the Quitline, it's basically everything. So we work with every language. We have coaches here that speak English, Spanish, and Arabic, and then outside of that, we use a service called Language Line to provide real-time translation services while we're doing the coaching. In terms of attempts that we make to reach someone, as I went over earlier for the AICTP, we actually make 7 attempts. So if somebody has an appointment scheduled with us, let's say for tomorrow, and we call them and we were not able to reach them, we'll leave a voicemail and we'll try 6 more times after that before we discontinue contact. So there have to be 7 attempts in a row that are unsuccessful in order for us to discontinue contact. And then in terms of types of tobacco, we serve people using all types of tobacco. So that includes vaping devices, hookah, smokeless tobacco, anything you can think of. We really treat those all the same, and we do view vaping devices and e-cigarettes as a tobacco product. That's our stance at National Jewish. So we will certainly counsel someone and offer NRT whenever appropriate for those using vaping devices as well. So approximately how long does it take to receive NRT? I'll even build on this as well. Another question we get that I didn't put on here was about PO boxes. So we absolutely will accept a PO box, and we can send our welcome packet to a PO box. And in fact, our NRT vendor can send their package to a PO box as well. So that's never a barrier. It's never a problem. We submit orders for NRT nightly over to our fulfillment vendor. They're in Minnesota, and they typically ship those out within 1 or 2 business days of order receipt. So it's pretty quick. We quote each participant that they won't receive the order for about 7 to 10 business days, but in reality, depending on where they sit in the country in relation to Minnesota, they're probably going to get it a lot quicker. We just want to set the expectation a little bit higher so they can be pleasantly surprised. The participant can actually call their coach at any time for tracking information. We get that into our system, and we can click on the link to find out exactly where the package is. And it's also available if they have enrolled online and they've set up a profile on our website. They can log in and get their tracking number on the website as well. We will leave the package on the doorstep if no one's home. So, you know, every once in a while we get a call from someone where the package has disappeared, it's been stolen or whatnot, and so they can just call us to see if we're able to replace the order. Typically we are. In terms of scheduling our appointments, we work within a 3-hour window. So we don't make specific appointment times, say at 12:30 specifically. It would be between like 9 to noon or noon to 3 o'clock or 3 to 6 and so on and so forth. And the reason that we do that, we did a lot of evaluation about that several years back, and we found out a lot more people were missing specific appointment times. So what we do is we tell the caller, your appointment time, we will call you between 9 and noon today, and of course we find out, we set that appointment with them, we find out what would work best for them, what day and time would work best. And then we encourage them, if for some reason that time frame doesn't end up working for you, or let's say you are specifically available at 10:20 that day, and that's when you need to do your coaching call. We encourage folks to call us directly for a coaching call. So no one has to have an appointment in order to do a coaching call. They can call us at any time to get that done. So just because we have that 3-hour window, and just because their appointment's set, let's say 2 weeks from now, if they're having trouble and they need to talk to a coach, they absolutely can call us. And so what do we do to prepare for higher volume times? We're in one of those right now, although we're kind of coming down from the highest part of it. So every year for the past 5 or so years, the CDC has done their national tips campaign. So they do a lot of national media with the tips from former smokers commercials. And that actually drives a lot of volume to the Quitline. So this year it started in January, and it's been constant and will run through almost the end of July. So we see higher volume because of that, and basically we prepare for that for staffing. So we do hiring. We did probably, about 4 or 5 different hiring fairs to prepare for that. We shorten the training sometimes. So if we are in need of coaches really quickly, we will do a hiring fair, hire a bunch of people. We'll do the more abbreviated CSR training so they can at least do intakes. And then when things start to slow down a little bit, when we have little lulls in our volume, we then put them into coach training to finish everything up so that they can come back on the floor as a coach. So we did a lot of that this year. You know, based on circumstances outside of our control, sometimes the CDC decides to ramp it up with little to no notice. They did something this year where they did advertising during the doctors, Dr. Phil, other programs, nationally syndicated programs like that, and that really drove a ton of volume to our call center, and we had very little notice for that. So, during these times of year when there's heavy media, I always like to prepare people that there will be longer hold times sometimes, and sometimes you'll have to wait a little bit longer to get your next coaching call just because of the higher volume, but it'll start calming down. And typically in the summer, late summer, early fall into winter, we slow down quite a bit. We also offer overtime to our staff, and we adjust staffing numbers throughout the day pretty constantly, so as best we can. So when is voicemail returned? Voicemail is typically returned with, as I mentioned earlier, within about 24 to 48 hours, as long as the person is leaving us a clear and concise message with their contact information. Sometimes we get voicemails that we can't understand, but as long as all that good information is left for us, we check voicemail throughout the day, and we will call back within 24 to 48 hours. How many times can someone enroll in the program? So this is regardless of what type of program it is, whether it's the general program or the AICTP or our pregnancy program. Someone can enroll an unlimited amount of times. So none of our states put a limit on coaching re-enrollment. Where the limit comes in for some of our states is around receiving nicotine replacement therapy. So most states will only offer it once per year. So if their benefit is 8 weeks, then they'll get up to 8 weeks once per year. And then we're lucky enough to have a couple states that are able to offer that benefit up to twice a year, or maybe even more. So really they can determine that when they call in with their coach. The coach will give them information about what's available in their particular state. After a file has been dormant for about 90 days, we do a re-enrollment anyway. So if we've lost contact with a participant and it's been 90 days since our last contact, we really feel like we need to kind of catch up on their tobacco usage information. And so we do a whole new intake and we start the coaching process over. Now, if someone calls in within that 90-day time frame, we go ahead and move them straight into the next coaching call where they left off at. So if they had completed coaching call 2 and they call us back within 40 days, let's say, their next coaching call would be coaching call number 3. And then, as I mentioned earlier, in terms of the Quitline calls, the caller ID, typically our national number will show up. So this is the numeric of 1-800-QUIT-NOW. So 1-800-784-8669. But this varies widely by carrier. So, a lot of our states are getting out into the community and trying to prepare people for the fact that, here's the number that the Quitline will be calling on. Make sure you answer it. And unfortunately, there's no easy answer to that. It's not always the same number. In some areas of the country, on a cell phone, it will show up as unknown because that carrier didn't pick up our caller ID. We have some instances now where it actually will say Quitline. So it really varies. And I guess the best way to approach that is if they get a call from an unknown or 1-800 number, try and answer that call, and they will be able to determine right away if that's us. So, and we will always leave a voicemail whenever possible. So with that, I really, really appreciate your time today, and I want to open it up to questions. Hopefully this information has been good for everyone, and I appreciate it.
Alrighty, thank you, Hilary. Yeah, for anybody that would like to go ahead and type in their questions, feel free to use the question box on the lower right-hand side there. And we'll go ahead and do a little Q&A session here before the top of the hour. Again, we want to thank Hilary for presenting for us today. Also, just want to let everybody know that we'll be sure to have the archive of the video of the webinar put up tomorrow on keepitsacred.org on our website, and we'll send out an update to everybody on social media, on Facebook, Twitter, and LinkedIn when we actually get that all put up. So if you want to follow us on Facebook, follow us at facebook.com/keepitsacred. You can follow us on Twitter at Keep It Sacred, or you can follow us on LinkedIn at linkedin.com/company/Keep It Sacred. And like I said, we'll go ahead and post the update up there. So far, we do have positive comments, Hilary, saying that the presentation was very informative, and thank you for the presentation.
Great. Thank you.
Again, just waiting on questions here. We'll keep it open for another minute or so. See if anybody has anything they wanted to add. Also, we'll be sending out the Survey Monkey tomorrow as well. The GoToWebinar will automatically send out a link. And for folks that attended today, if you could please fill out that survey, offer your thoughts and evaluation on how we did here today, and we'll go ahead and send everybody that fills out the survey their continuing education units as well. Well, it doesn't look like anybody has any questions at this time, so we'll go ahead and wrap it up. We want to thank Hilary and thank everybody for attending, and I hope everybody has an awesome day. Thank you.
Thank you.